welcome to Mad Medicine with Miss P. Giving up on my clicker there, it's completely useless. So, I got some good stuff this week also, as well as adorable things students had charted over the years. The most recent one from this week from patients is a patient was going to get, I'm going to have to write this one down, a steroid epidural shot in the, now I'm sure it was a typo, but still fabulous. They're going to get it right in the nerve, not sure where that is, but still like it, love it. And another patient, I'm not making this up, you guys, this is straight up what they chart, I'm not kidding, what they put this in themselves. This patient thinks that they're allergic to fiberglass. Do you get red and itchy when you roll around in fiberglass? That's because it's fiber glass. Everybody fiberglass. So make sure you don't administer fiberglass to this patient when they come in for surgery. Oh, this one gets a step infection. When you infected by steps. Sure, just a typo. Doesn't make it less funny. Along with other allergies, and I should have written them all down, but I just didn't have time. This patient's allergic to ammonia. Probably makes his eyes water. Throat burn, ammonia. Deviated symptom. This patient did have a deviated symptom. That's why they were coming in. Their symptom was deviated. Here's a word I hear all the time. It's a non-word, of course. And I don't know how you would spell. I'll tell you how I spells it. Nauseated. That's Naushhiated. Nauseated. It's not a word. Stop saying it. It's killing me. I listened to this little YouTuber. I told you this. She's probably a millionaire because she's got, jillion followers. She says supposedly all the time. And there's another word that doesn't exist that she makes up. And I watch a very, very, very famous YouTuber, her mystery and makeup. She says, especially, and so does my son. There's no X in especially. Especially. She says it every time, and so does my boy, and they both have the same name, which is just very ironic. This other patient yesterday charted that she had a herniated ulcer. I can't even describe that, a herniated ulcer. All right, it's herniated, when ulcers get herniated. Okay, so here's stuff that the students charted. I know this is your favorite part, so here it goes. Y'all have been begging for years for me to do it, so from what I can remember. Pulse 50, nurse noted, will hold lisinopril. Okay, well, now when I first saw that, I thought, first of all, that's not a note. There's so much missing in there. Are they symptomatic of bradycardia? Can you hear S1, S2? Are you going to give me anything, with that other than just that their pulses? Is that you're going to need some assessment there? But will hold lisinopril. Now, as ridiculous as that initially sounded, I went back and looked at the order, and there's literally a note that says hold lisinopril for pulse less than 50. And I'm like, that lisinopril doesn't affect your pulse, but okay, stay with me. So as we all know how ACE inhibitors work, they inhibit angiotensin 1 from converting to 2, this particular one. Some are ARBs, they work differently. But for the most part, what we're doing, it's like we said, whether we stop angiotensin 1 from converting to 2, make 2 inactive, or block where 2 wants to go, the bottom line is we are stopping vasoconstriction. So if we stop vasoconstriction, that means that we're creating, like a lesser ability to raise our blood pressure. So it's not necessarily going to drop it like a rock, like it would drop mine, because as mine, constricts and relaxes, vasodilates and so on throughout the day for whatever I need. With this on board, because I don't have hypertension, it would affect me and it would make my blood pressure too low, because when my body wanted to constrict, it couldn't, and it'd be too low. So if your heart rate is low and your blood pressure is really low, then you can get into trouble, right? So legit, but you need more. We need a little more there, but I'll take it. Oh, here's another favorite one, and I get this. Cyanosis to petals. Okay, first of all, that's your feet, your cyanotic feet, let's just say. A pedal is more of an action, but okay. Um, Now, if you mean that this 100-year-old lady has the purple feet syndrome, that's normal. There's no adipose there. That is just vessels, nerves, and tendons underneath a very thin sheet of skin. Yes, that's what we look like on the inside. It's not cyanosis. I know you learned cyanosis as a bluish discoloration, and I gotta say, I kind of blame a little this on how it's taught. And, same thing with when I'm not in giving the school a hard time because it's the same thing when I was going through school. They kind of teach you these things in a way that it doesn't necessarily make sense. You're like, this is what it means, and that's what that word is. So you're like, oh, okay, well then that's bluish discoloration of the skin is cyanosis. No, cyanosis is bluish discoloration of the skin secondary to or related to or because of hypoxia. So those tissues aren't getting enough oxygen, hence the change in color. It's not when we get older. We don't get cyanotic feet. That's not how that works. Patient DC'd went home with Lasix. I'm going to hope that's not the only sentence in that discharge paragraph. And as we all know, it should be a paragraph, right? Patient went home, DC'd home with whom they're with. Not, I mean, is that their Aunt Lasix? I don't know. That'd be a great name. I would totally, now, I'll name my next dog Lasix. That's good stuff. Or my next horse, come a running Lasix. Could have two meanings. But in this case, it's not so much that they went home with Aunt Lasix. You want in a chart who they went home with, who collected their belongings. Did you take out their IV? Did you take off their telemonitors? We need a whole lot more here. Just the fact that they went home with Lasix, that's not enough. You need to tell me why they are on Lasix, or at least, kind of give an order, the dose, the route, the frequency, and, maybe a little more of just that. Surely they're not going home on that one pill. So we need a little more there, but still good stuff. Patient admitted with symptoms of a cough. Symptoms of a cough, like not a cough, just symptoms of a cough. They're about to cough. They look like they might cough any minute. Symptoms of a cough. What do cough symptoms look like? Fabulous. Dehydration from excessive nausea. You can't get dehydrated from nausea. You can get dehydrated from lack of fluid intake secondary to nausea, but nausea itself doesn't make you dehydrated. Dry heaving doesn't make you dehydrated. You have to actually throw up and not consume in order to become dehydrated from excessive nausea. Telemonitor, no number, showing sinus rhythm running AFib. Do you feel my pain yet? Do you see? Precious, but I'm curious, like, what is going through your head when you're charting that? As you're writing that down, there's got to be a little part of you that thinks sinus rhythm and AFib. Sinus rhythm with bouts of AFib? Unlikely, but could happen. Sinus rhythm running AFib? That's not a thing. And again, I talked to like 3 patients yesterday. Well, I have an arrhythmia. My heart skips a beat. How many beats do you think you have that you could tell if and when one was skipped? Do you skip a breath? I don't. That's who tells them this? What cardiologist is telling people this? Like, oh, your heart skips a beat. Which beat is it? Is that an SA beat? Is that an atrial beat? Is that a ventricular beat? What beat are we talking about? None of that makes sense. I hate when they say that. Or this patient thinks that they had a pacer implanted because of PVCs. I'm like, that would be a lot of PVCs requiring a pacer. But even then, a pacer doesn't stop PVCs necessarily. I mean, it can't control additional beats if your heart is doing that on its own. So maybe they did an ablation for, I don't know. And you got nothing from it. They know nothing about it. They don't know what back surgery they had. I'm thinking if you're going into my spine and I'm signing consent that says there's a, not a really good chance, but there is a chance that I could be paralyzed, like from the neck down or the waist down or whatever it is. I'm thinking I'm going to know what the top of that consent says. Was it a laminectomy, a discectomy, a fusion? Is there hardware in there? It's astonishing how people have no idea what kind of surgery they had or are going to have. I have a hernia. Well, congratulations. What's the doctor going to do for you on Tuesday? Startling. Okay, sterile water, 10 milligrams. I guess that was on a med list. 10 milligrams of sterile water. Stat. Sorry. Narcan for respiratory rate less than or equal to 2. Okay. You're a little too late. If you're waiting for the respiratory rate to be dos, you were too late. You missed it. That patient is like this close. You better get your epi because that patient's on its way out. Normal lung sounds. Oh, all right. What do the sounds sound like? The lung sounds sounded normal. Oh, that's good. Normal lung sounds. What's normal lung sounds? History of sinus rhythm. Well, that's good. It's a history though. That's not current. It was previous. They used to be in sinus rhythm, and now they're in what? An arrhythmia. That's what I get all the time. I have an arrhythmia. Okay, well, what was it? Oh, I don't know. I kind of feel like that's one thing I would know. Like, I would like to think, what if I never got into, nursing or the medical side? I wonder if I would say those same things, because I'd like to think that when I go to my mechanic, I don't say something like, my car's making like a sound and I don't know what it is. I'd like to think I would go in there and have an idea of how that engine's running, so I can tell them, if and when I'm hearing this particular thing, or when it's giving, or when it's lagging, or, if you hear, something banging, or your little lifters. God, I had a little car that just rattled those little lifters. But you would think that and maybe I wouldn't, like what I tell my plumber, it's making a whooshing sound. I don't know. I mean, I don't know that there's super technical terms for other things like that, but I'd like to think that if it was my own body, my health, my number one, like if this isn't working, none of that other stuff matters. I'd like to think that even if I wasn't in nursing, I would still have an idea of what's going on. They don't. Oh God, this was one of my all-time favorites. These are students when they're in the ER. They have to fill out the sheet and it says code status, and then you have to write in their code status, which means, are they a full code? Are they a DNR? And this student wrote, and this is not the only time I've gotten this, it's just a couple times over the years, but every time was precious. Code status, blue. That's their current code status, blue. In their defense, the patient was in a code blue right then and there, but that's a full code. If you're coding him because they called in code blue, he's a full code. So we're going to actually code him right here and now. That's not a status, is blue. Yeah, oh look, that's blue right there. And that's not how we say it. S1, S2 audible with regular rate and ectopic rhythm. That's a term that someone heard. That student has no idea what that meant, didn't ask. What does the word ectopic mean? Right? Coming from someplace else, not where it's supposed to be, right? Like an ectopic pregnancy is not in the uterus. So this ectopic beat or this ectopic rhythm is coming from someplace other than the SA node. It's not originating there, and that's the problem. But you still have to tell us what rhythm, what's happening. It's not, I got the ectopic rhythm. Doctor called, Mama's got the ectopic rhythm. No. S1, S2 audible with tele showing AFib or history of. I think that's what that says. I don't know. It's just precious. I'm not gonna lie, I miss it. I do, I miss it. All right, let me see what's on this next page here, and then we'll touch in a little of this, and then we'll have to finish. Oh, gotta remember that. Oh, I do remember this list. Okay. There are some precious things in here, and again, I never know if they are repetitive, and I hope not, but I've tried to rewrite it one time, and I guess I got messed up. I did have a patient tell me they wrote in that they were allergic to sulfur. SULPHUR. I think that's well water. I think that patient's allergic to well water. A good thing we don't have it in my facility, so I can't give them well water. Plavix, 75 milligrams PO until INR is less than 20. I hope that means 2.0. That's probably 2.0. Plavix 75 PO until INR is less than 2.0. I don't know what any of that means. Maybe what's happening here is that they are also on Coumadin, and then no, I got nothing. I got nothing. This is just what y'all write, and then I have to try to decipher. And then of course when I call you over and I say, what does this mean? You say stuff like, oh, I don't know, that's what the nurse said. Did it make sense to you? Did you question it? No? All right, just checking. Oh no, I did go through most of this. Did I tell you about the hereditary symptom? That's hereditary symptom. I don't know what that is, but I think someone charted that. No, I think we did this. Yeah, I think most of these we already went through. I guess I put them back in here. All right, so a couple here, and then I'll try to organize this for next time. Okay, a patient, when they come in or when they are filling stuff out online, they can tell you, what they want or how we can make things better. And this one wrote that she wanted a warm and compassionate anesthesiologist. So, oh, I'm sorry, we are all out. Like, I quit. We don't have any of those now. Just the regular ones. Oh, and I told you about the reflexology, right? GERD. You have GERD, the reflexology. That's, GERD. It's fabulous. Patient has a fibrillator for AFib. In case they come out of AFib, they can be fibrillated back into it. A fibrillator, not a defibrillator, a fibrillator. That's one who fibrillates. Oh, I know, I did remember this. I saw on a chart, a doctor charted that Miss Jones is single and she is a nun. None. She is a nun and she has a son. And she's going to have one. That's just what it said. Miss Jones is single and she is a nun, None. I'm assuming that's a transcript typo. And she has a son. How do you suppose that worked? Can you have a child and still become a nun? I don't know. Very, very interesting. Allergic to hypercodone as opposed to the relaxed kind of codone, and penicillin. I've seen that before. Fibromyalgia. Oh, I know that. I've been there. I've been to Fibromyalgia. It's beautiful country. Rotary cuff tear. At least I said cuff because usually it's a cup. Oh, yes. A patient did chart that they had epileptic shock from iodine. Epileptic shock. Is that a thing? Epileptic shock. And another YouTuber I listen to talks about, he had an epileptic seizure. Just one? He had just one epileptic seizure? If you have just one seizure, you're probably not epileptic. That's not what that word means, but okay. Oh, and I did tell you that the patient went to Centennial Park to have his colon polyps removed. Isn't that a crustacean? I don't know. All right, so that's it. I'm going to get through this and try to figure out so we're not repetitive for next time. But and then I've got a couple other little things, and then I think I'll do maybe a little disease process. Then I quit. So I got as we know, 100 things to do. And I just polished off almost an entire cake, this very moist cake my husband made. I couldn't stop eating it and smothered with frosting. So, I've got to get to the gym so I can lie in the tanning bed to look skinnier. Okay, same as always. Face your fears, forget your failures, follow your faith. Love you. See you next time.